Okay, ladies, so I get a lot of questions from you about what my particular hormone therapy protocol is. So I want to share that with you right now. I did a lot of research before I went on hormones because I was concerned, like you, about a lot of the info we heard about the Women's Health Initiative and causing cancer and what are the long-term effects. And after a lot of research and talking to a lot of doctors, I decided to embark on my therapy. And it's been 3 years now, and it's unbelievable the difference of how I felt compared to how amazing I feel now. I had terrible anxiety, my sleep was poor, I had terrible joint pain, especially lower back pain, which really affected me in the gym, which used to bum me out, and fatigue. I dragged myself through my day all the time, and it was so hard to get out of bed in the morning, which is so not my personality. And being on hormones for 3 years, all that has disappeared, and I feel the best. So I want to share my protocol with you. I'll start with my morning routine. So in the morning when I get up about 5:30 a.m. I take my Armour Thyroid, which is T3, your free T3 hormone. It's your metabolism. It helps with that energy. It helps giving you that little spring in your step. It helps you with fat loss, and it helps your metabolism. So I take my Armour Thyroid and I have to wait about 30 minutes plus before I eat any food. So that's the first thing I take. And then when I'm getting ready for work, what I do is I take my estradiol. Yes, I take an oral bioidentical estradiol. This is not equine horse urine estradiol. This is a bioidentical made from plant sources in a compound pharmacy, and this is 2.25 milligrams. So I do use an oral estradiol, but do know that everybody's an individual and everybody is different. There are many different ways to take estrogen: oral, vaginal, suppositories, creams. Just patches. You have to find what works for you, and that's what you'll do with your doctor. What I also take with my other vitamins later on is my DHEA. This is 60 milligrams. It is compounded, but you can buy it over the counter. It helps with adrenal health. Your adrenal glands, which is where DHEA is made, sits on the top of your kidneys, and it's primarily responsible for helping you to balance your cortisol, your stress levels, but it's also a precursor to making testosterone. So, footnote, I will use this with my women that are not on hormones if they're telling me that they're tired, they're having a hard time building muscle, they're having a hard time losing body fat, and their libido's in the toilet. I will have them use some DHEA. Then when nighttime comes, before I go to bed, I take 1 capsule oral of my progesterone, which is 250 milligrams, and it helps you sleep, it helps with anxiety, it helps with depression, it helps with your mood. It does contribute to bone health and brain health and heart health as well, but it really is a game changer if your sleep is poor, ladies. Progesterone, and it almost works instantly when you start taking it. And then before I go to bed, I take 1 little pump of my testosterone cream. Usually I'll put it here and rub it in. You can put it on an inner thigh, you can put it on your calf, you can put it on your belly. It's also known to be good if you take your little pump and then put it right on the hood of your vagina. It helps with vaginal atrophy, and it'll help keep your vagina skin healthy as we get older, which is so important for us ladies to help prevent urinary tract infections. So that's pretty much my protocol. If you have any questions about anything I said, please ask me, DM me. I'm always happy to talk to you about anything: hormones, nutrition, supplementation, training. We got to stick together, ladies, because we have so many great options so that we can age long and strong as we should.